Welcome back. The deadly superbacteria, also known as superbug, which is resistant to antibiotics, is currently posing a threat in populations in Southeast Asia, Europe, and North America. Now, here to tell us about this threat and how we can protect ourselves from it is Lyle Morrell, Health Business Director of Watson's Pharmacy. Good morning, Lyle.
Good morning, Paulo.
All right, the superbug. When I first heard about the superbug, of course, it sounds like a fun sort of thing. Superbug, but then again, it's serious stuff. I mean, this is a bacteria, a strain of bacteria that's developing because of an increased resistance to antibiotics. Give us the big picture.
Yes, the reason why it's called a superbug is because this is a type of bacteria that has developed a strain that has proven to be resistant to all and any forms of available antibiotics.
Okay.
So while bacterial resistance has been with us, this is even deadlier.
Okay.
Because the other bacterial resistant pathogens or bacteria can still respond to combinations, but there are already strains that does not respond to any available antibiotic in the market.
All right, and that's the nature of these bugs, and in this case, the superbug is you create a cure, an antibiotic to address this bacteria. And then what it does is it mutates, it creates another strain, which another drug will be created for, and so on and so forth, correct?
Yeah.
But the underlying problem really here is that we are forcing the bacteria to mutate and create a strain which is resistant to whatever medicines we now have.
That's precisely the point, because of our own doing, we have actually set the stage for the development of an organism, a bacteria for that matter, that has learned to adapt and be able to resist the action of antibiotics. And the experts actually are forecasting a very dangerous and grim scenario, which they call a perfect storm. Because on the one hand, you have the emergence of a superbug or bacterial resistant organisms, and then on the other hand, the pharmaceutical companies have actually, unfortunately, over time, have already stopped researching and developing new forms of antibiotics.
Okay.
So you have a powerful bug, you don't have the armaments to fight it. So it's possible that there may be a time in the future, if we don't act now, that we have nothing to use for these types of bacteria.
Okay, that's a scary thought. Now, the bacteria is now known as NDM1, which stands for New Delhi Metallobeta-lactamate. Well, it sounds complicated.
Sounds complicated, yeah. It's actually the NDM1, as they call it briefly, is a type of superbug, because it is a bacteria that whose strain is resistant to any type of antibiotic.
Okay.
And the reason why it's called New Delhi, because that strain was discovered in New Delhi, India.
Okay, okay.
So, but we have a chance now to avert this looming medical crisis here in the Philippines. So what we need to do is act now. We need to be more responsible and more rational in the use of antibiotics.
Okay, well, I mean, it was first found in New Delhi, or first cases were in New Delhi, and it spread all over the place from there. And you can see that this is the pattern that's going to happen. It's gonna develop somewhere, and it's going to spread pretty quickly. And like you said, sort of a very grim doomsday scenario is that a large part of the population will be affected, and we don't have what it takes to fight this strain. Now, the problem, like we said, is really antibiotic misuse, and this is basically people. Is this people self-medicating? Is this people over-medicating? What is the case?
Yes, unfortunately, over the years, we have been guilty. All of us have been guilty of antibiotic misuse and abuse, and largely due to rampant self-medication, as well as non-completion of the doctor's prescription.
Okay.
Those are the most common types of irresponsible antibiotic use.
Use or misuse.
Yes, misuse,
it's interesting that you mentioned that actually not completing. Like usually when you do have a course of antibiotics, okay, take this and this and that for 1 week, or take this and this and that for 2 weeks, or whatever the case is. when you don't complete your course, you're actually helping things along, because this is how they develop more resistant strains, correct?
Yes, that's right. The objective of using antibiotics is to make sure that you kill the bug.
Okay.
If you don't complete the prescription, all you do is just make the bug dizzy or a little weak. So if you don't give the killer punch, the coup de grace, they call it, the knockout punch of Manny Pacquiao, then the bacteria can always regain its strength again
and fight another day.
Fight another day. This time knowing how to fight.
Okay.
Because they've already read how the antibiotics work on them.
Okay. In theory, though, my thought is, in theory, is when you have some sort of an infection, when you have some sort of an illness, you generally turn to the lowest type of drug rather than jump to a very high efficacy, because when you hit it with a high, how do you call it, a more highly developed drug, then it develops a strain to that particular drug and cancels out everything else that's available behind the newly developed drug. Is that correct?
Yes. Unfortunately, while there are different types of antibiotics, a lot of them actually have similar chemical structures.
Okay.
So that if a certain bacteria is already resistant to the most common and basic type of antibiotic, for example, amoxicillins or ampicillins,
okay,
it actually learns to defend itself against the more potent type of antibiotic. That's why as early as now we really have to really change the way we do things and be more responsible and rational in using antibiotics.
Okay. Watson's is working with Unilab on a campaign to really help people understand about the use, misuse, and the things that we should be doing to make sure we combat these doomsday scenarios. What should we be doing?
Yes, thank you for that, Paulo. So during this season, like now, rains, floods.
Yeah.
So this is the time when people start thinking about buying antibiotics.
Right.
When they start feeling bad, they feel feverish, they feel sore throat, antibiotics and paracetamol.
Right.
So we, in partnership with Unilab and in support of the government's efforts at really ensuring that we use medicines responsibly, Watson's has launched a compliance program.
Right.
This is actually the second phase. We did the first phase last year, but this time we're focusing on antibiotics to address the dangers of the rise of the superbugs. So it's a compliance program where we chose the widely prescribed antibiotics for common infection in the community, widely prescribed by doctors. We pack them in their usual full dosage treatment, and then we'll be helping the people be able to afford these antibiotics by partnering with Unilab so that we are able to provide the highest quality generics at the most affordable price. And this program also involves us educating the public. So this compliance packs, as we call it, also includes an educational material that talks about infection, what type of infection needs an antibiotic, what is an antibiotic, and how antibiotics work for this infection, and what are the dangers of not completing the antibiotic course of treatment or using the wrong type of antibiotic.
Okay. Quick question here, though. You can buy antibiotics over the counter. You don't always need a prescription, do you?
Well, that's really the common misconception. Generally, a lot of people out there think antibiotics are OTC products, but antibiotics are prescription products.
Okay.
It requires a doctor to determine whether a patient requires already antibiotic to address a bacterial infection.
Okay.
A lot of people use antibiotics actually for treating viral infection.
Okay.
Because generally, our infection starts with a viral infection because virus is in the air.
Okay.
And it is manifested by way of feeling fluish, body pains, aches, fever, sore throat, runny nose. So these are actually generally self-limiting. Rest, a lot of fluids, vitamin C, vitamin supplements will do the job.
Help you along, right?
So generally, you don't need an antibiotic, but there is a large misconception out there that antibiotics, especially amoxicillin, can be bought over the counter.
Will cure everything, and will cure everything. Yeah. All right, so the facts are, we're setting ourselves up for a very, very scary possibility of we're there actually, of creating a strain of bacteria that is resistant to anything that we currently have. So really, it's the proper use of antibiotics, and knowing that you do need a professional to actually tell you what you need is probably the first step that we should be taking.
That is correct.
All right. Well, thank you so much for letting us in on this, and definitely this is something that we should all be supporting and helping people to understand that there's a very dangerous possibility out there.
So I enjoin our viewing public. During this time of rainy season, it's possible that you do feel bad sometimes. Visit our pharmacies. Our pharmacies are trained to help you understand what you have and suggest other therapies, appropriate therapies, to help you be alleviated from your symptoms without necessarily resorting to using antibiotics.
All right. Well, thank you so much for joining us this morning. Lyle Morrell from the Health Business, he's the Health Business Director of Watson's Pharmacy. Thank you so much, Lyle.
Thank you so much.